Spastic cerebral palsy is the most common type, affecting approximately 70 to 80% of all cerebral palsy cases. It's characterized by increased muscle tone, also known as hypertonia, resulting in stiff and jerky movements. People with this condition often have difficulty controlling their body movements. There are several subtypes of spastic cerebral palsy, classified based on which limbs are affected. Spastic hemiplegia affects one side of the body, with the arm typically more involved than the leg. Children with this type often experience delayed walking. Spastic diplegia affects all four limbs, but the lower limbs are more severely impacted than the upper limbs. This often results in a distinctive scissor gait pattern where the knees and thighs cross or hit each other during walking. Spastic quadriplegia is the most severe form of cerebral palsy with significant motor impairment of all extremities. It is often associated with intellectual disability, seizures, and speech and visual abnormalities. Less common presentations include spastic monoplegia, which affects only one limb, and spastic paraplegia, which affects both legs but not the arms. To summarize, spastic cerebral palsy is the most common type of cerebral palsy, characterized by increased muscle tone and stiff movements. It has several subtypes based on which limbs are affected, with spastic quadriplegia being the most severe form. Beyond spastic cerebral palsy, there are several other distinct types that affect different parts of the brain. Extrapyramidal cerebral palsy is relatively rare. This has become less common with improved prevention of kernicterus, a type of brain damage that occurs from severe jaundice. Infants with extrapyramidal cerebral palsy are characteristically hypotonic with poor head control. As they grow, they often develop involuntary movements. Ataxic cerebral palsy results from damage to the cerebellum, often due to oxygen deprivation during birth, known as perinatal asphyxia. It's characterized by low muscle tone, intention tremors, which are shakiness that occurs during voluntary movements, and an unsteady, wide-based walking pattern known as ataxic gait. Many patients present with mixed types of cerebral palsy, showing symptoms of multiple types simultaneously. For example, a child might have both spastic and ataxic features. The most common combination is spastic with ataxic cerebral palsy. Mixed types can make diagnosis more complex and require comprehensive, individualized treatment planning. Let's compare the different types of cerebral palsy we've discussed. Extrapyramidal cerebral palsy affects the basal ganglia and causes hypotonia with involuntary movements. Ataxic cerebral palsy affects the cerebellum and results in tremors and an unsteady gait. Mixed types affect multiple brain areas and present with combined symptoms from different types. Regardless of the type, early identification and intervention is crucial for improving outcomes in all forms of cerebral palsy.